The main value is creating a community of psychotherapy researchers and clinicians so that clinical research, psychotherapy research can be informed by clinical practice, and also that clinical practice can be better informed by psychotherapy research. I think the creating of that community of researchers and clinicians who have discussions and who have a dialogue about what the nature of psychotherapy is, how best to do research, I think that's probably the biggest asset of a psychotherapy practice research network. I think probably the most useful aspect for clinicians is their ability to improve their practice and to improve their clients' outcomes, the patient's outcomes. Knowing about what aspects of psychotherapy, what the research has to say about the most effective aspects of psychotherapy can really help clinicians to make a big impact on their patient outcomes. For example, there's emerging research about clinician reflective practice, the ability to think about what they're doing during the sessions or before and after the sessions in a systematic way, either by continuous feedback or some other reflective means. That has a big impact on patient outcomes, and I think clinicians can and have made use of that knowledge, that research, to improve their patients' outcomes. The main resistance is a sense that the psychotherapy research to date may not be relevant to their clinical practice, which is not always true, but sometimes is. And I think the other main resistance is this sense of being disenfranchised, not being part of the research program, of the research endeavors, makes clinicians feel like decisions made about what kind of psychotherapy to practice, what techniques to use, what process issues are important, are imposed upon them by clinical researchers in academic settings. And so that creates a real tension in psychotherapy practice and research that I think clinicians normally would resist. And I think that needs to be overcome by creating networks of clinicians and researchers who have discussions about what's important to psychotherapy and what's important to research. I found the focus groups in Bergamo to be very interesting. There was a very enthusiastic group of clinicians. It was a very diverse group of clinicians, which is very exciting, but it's also very challenging. When you have a very diverse group, you have a lot of interesting and innovative ideas about how psychotherapy should be practiced and about what kind of research should be undertaken. The challenge, of course, is that it makes it a little bit more challenging to bring a diverse group together to have a single vision of psychotherapy and of research. And so I was very excited by the focus groups in Bergamo in particular, where there was a lot of discussion, a lot of animated back and forth between participants. And I hope that there will be a sort of a unified vision among the diversity of clinicians and clinical practices. I think the process of psychotherapy training in Europe is different than in North America, and from what I've seen, much of the emphasis has been on clinical practice, which is very good. I think training that integrates research into the training, that in particular that allows clinicians to be good consumers of research, to understand the research and to use it to inform their practices. I think if that were a bigger part of the training, that would be, I think, a great advancement for psychotherapy.